It's something that I think is often overlooked, and this is something at fertility specialists that we are passionate about, that it should be something that's addressed appropriately. The male partner often feels not very engaged in the infertility journey. He's obviously essential and crucial to this, not only as supporting his partner, who obviously have to go through a lot of investigation and tests, but also things that we can do to improve the male health will actually improve outcomes. And there's evidence to say that the health of the man at the time of conception can actually influence the lifelong health of the child. So male health at time of conception is essential. So perhaps leading on from that, you can probably infer that the lifestyle factors and male health have a major impact on his testicular function. Consequently, as we're all getting perhaps less fit and healthy, probably putting a bit of a girth on around the waist, is commoner with male pattern obesity. That is effectively very negative on sperm function. So a man that's pre-diabetic, overweight, or certainly has some condition which we might call the metabolic syndrome, has definitely associated with reduced sperm parameters. So it's crucial that the man gets fit for pregnancy. Essentially, I don't treat any couples where either the partners smokes, for instance. Smoking is very detrimental to the sperm, not only its parameters, but also the DNA within the sperm. And there's evidence to show that children born to a man who smoke have a higher risk of cancer. So it's essential that the male joins his partner in that healthy journey before conception. The man just needs to do a few things for a few months and they have major improvements on his sperm. So he needs to be taking a regular multivitamin, he needs to get healthy, fit for conception, eating a good diet. Also then there are unfortunately circumstances which is out with the man's control. He has a concurrent medical illness. And often patients will say, is this medication I'm taking for my concurrent condition, is it affecting my sperm count? It's often very difficult to work that out because obviously he's taking the medication and it's his partner that gets pregnant and it's the child that's born to the woman. So trying to work out, was the medication that the man was taking, did that impact on the outcome? There's so many variables that unfortunately therefore the literature is not very good on this. Also, the fact that he's got a medical condition, that is probably also adversely affecting his sperm count. So is it his medical condition or is it the medication he's taking that's impacting on these things? Very difficult to work out. But similarly to the woman, it's basically a man should be taking the medication sufficient to make him well, but not be over-medicated to get him as healthy for pregnancy. So extrapolating that further, you can probably imagine therefore that some medical conditions, particularly that damage the testicle, are probably going to affect the sperm count. For instance, a man who as a child had an undescended testicle, perhaps has what he was told was a hernia operation as a baby, perhaps it wasn't, it was perhaps being an undescended testicle down into the scrotum, mumps as a child, major testicular injury. Every man gets a knock in his testicles, but a major testicular injury is obviously going to have an adverse effect on testicular function. Unfortunately, chemotherapy or radiotherapy have a major adverse effect on the testicles. So, so concurrent medical history and things that have happened in the past can have major impact on the testicle and therefore the sperm count. But effectively, we should try to think of the cause of infertility as either testicularly related, so that's damage which is unfortunately therefore irreparable if a man has had chemotherapy and he's got no sperm. It's effectively similar analogy to a woman who's gone through an early menopause. The testicles have stopped working. Perhaps things that are remedial if he's got a central cause. So things like a head injury or a benign cyst in the pituitary gland at the base of his brain. Something like that, we can actually give some medication which will reactivate testicular function, improve the sperm. And also, therefore, there can be the third cause. It can be actually some obstruction to the ejaculation. So it's either central, testicular, or something in the journey from the testicle to out of the penis. So for instance, obvious thing as a man is that of vasectomy. Obviously, most men would obviously volunteer. Occasionally, that has been found that he's never actually admitted that he's had a vasectomy to the new partner. But there's sometimes some surgery can get around that. But unfortunately, sometimes that duct is effectively absent in a man who might be carrying the cystic fibrosis mutation. So effectively very similar to a man who's had a vasectomy. His hormones are fine, he appears normally healthy, but actually there's no sperm in his ejaculate because this duct is missing. Again, so simply by bypassing it, like a man who's had a vasectomy, will overcome that. So the causes are effectively the man's health, which potentially can be improved, testicular, which unfortunately is irreparable, central causes which we can potentially reactivate, or obstruction, which potentially can be overcome. So they're the causes really of male infertility.